Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. I am absolutely thrilled today to introduce you to Dr. Scott Antoine. If you don't know him, he is an exceptional functional medicine physician in the PANS PANDAS world. Scott completed his undergraduate training at the University of Scranton in Scranton, Pennsylvania, after which he completed his doctorate at the Philadelphia College of Osteopathic Medicine. He completed an emergency medicine residency, emergency medical services fellowship at Albert Einstein in Philadelphia. And he then served 7 years of active duty with the United States Army as an emergency medicine physician. Moving to Indianapolis in 2005, after his term of service, he worked as an emergency physician at St. Francis Hospital until 2019. In addition to his board certification in emergency medicine, he achieved board certification in integrative medicine through the American Board of Integrative Medicine in 2016, holds certifications in functional medicine through the Institute of Functional Medicine and A4M. And most importantly, his daughter developed pediatric acute-onset neuropsychiatric syndrome, or PANS, in 2013. And he and his wife, Ellen, who is also a functional and integrative medicine physician, were able to shut off the immune system, treat the infections and toxins responsible for her PANS presentation, and bring her to full recovery. After his daughter recovered from PANS, he knew his specialty had found him. And since then, he's refined the process, has helped hundreds of children, probably thousands since this book, Scott, recovered from PANS and PANDAS. And in 2019, he successfully lobbied the Indiana legislation and helped pass a law which prohibits insurance companies in Indiana from denying coverage for medical care, including IVIG for children with PANS and PANDAS, and has helped many of us be able to do that in our states. Dr. Antoine wrote a book for physicians on the management of PANS and PANDAS in children, which has defined the standard of care in this illness. It was released in February of 2024, and it's an Amazon bestseller. And as a fellow author, I can tell you his book, The Comprehensive Physician's Guide to the Management of PANS and PANDAS, an evidence-based approach to diagnosis, testing, and effective treatment, is really remarkable. 1,200 references. It's a great book. I've learned things from it, and I really appreciate you being here, Scott.
Thanks so much. I'm so glad to be here, and demystifying PANS and PANDAS, same thing. I have it on my desk since you gave it to me at, I think, the A4M Pediatric conference in maybe 23 in, I think, California.
Yeah.
So I have that.
And you know, what's fascinating to me is, you and I are on a lot of listservs together and chat rooms, and we've lectured together. And every time you answer something before I do, all I feel like saying is ditto.
Same here. Same here. I feel like we've been separated at birth or something, because I think we think and practice very similarly. So it's great to have the support of a fellow clinician with such a great depth of training, who had her own child with PANDAS, and then experiencing that, medical training. And I feel like we were trained in almost the same kind of a system where just, the patient is paramount, and there's the differential diagnosis and sort of a figuring things out. So
yeah. So you and I got into the field in similar fashions with our own children. Just tell me a little bit about that, as you would like to.
Sure. So I have a daughter. Her name is Emma, and when she's 23 now. When she was 12, she came to us one day and said, "I don't think I'm a good person. I don't think God likes me." And we kind of, we have 5 kids. They do weird things. And so I'm kind of like, oh, okay. And then a few days later, she started compulsively washing her hands. She stopped sleeping. Her grades tanked. She'd been a straight A student, and she couldn't even put a sentence together. And so we didn't know what was going on. And we called her primary care doctor at the time and told them what was going on. They didn't call us back. So I think it sounded like a frantic call from two physician parents. And so we ended up hitting the books. And my wife, Ellen, who's also a physician, as you had mentioned, came to me a few days later and said, I found these articles and I think she may have PANDAS. And I didn't know what that was. And so then so I read the articles and I said, that's exactly right. I mean, she has all of these symptoms. We ended up taking her I called initially around where we live in Indianapolis, and they said, it's not a thing. We don't treat that because it's just not a thing. So we did. Ellen took Emma to New York State and saw a physician there, said, yes, you're right. This is PANDAS. She needs IVIG. They came back. I tried to accomplish that. And I was told by a pediatric neurologist, look, it sounds like she just needs to be on antipsychotics and locked in a psych ward. And I said, really? Like
Ugh.
she was normal 2 months ago. What you're saying doesn't make sense to me as a physician. So ultimately we took her to the state next to us in Illinois and got her IVIG. And 4 days later, her symptoms were gone.
Wow.
So, and at that point I was just like, well, this was not something I would want anybody else to go through. And I think that happened to me as both parents, as physicians, like this. And as you and I both know from hearing thousands of these stories, this is kind of what happens a lot of times. So that was a big change for me. And it's hard. And I think we've talked about this before. I kind of don't like doing this work because it's a little PTSD every story I hear. But at the
Yep.
same time, when the kids get better, and especially when I have a parent that says you're the first person that listened to me, I think, oh, there it is. That's if I
Yeah.
can do that, even if we don't get 100% recovery, that's like a big victory for parents to feel like they're not losing their mind. And
Yeah. And I always say my best instrument in my office is a tissue box because they're so used to not being listened to, not being heard. Just listening gives them that peace that I'm not crazy, my kid's not crazy. There is a little bit of hope. And writing the book is a labor of love, especially with the 1,200 references or so you have. Why did you write the book?
so it's interesting because I initially started writing the book to parents and thought, oh, I'm gonna, and then I started thinking afterward, I well, it was taking a while because I was having to try and explain things and contextualize it. And I thought this would be much quicker if I wrote it to physicians. And I actually felt like physicians were the rate limiting step. I love medicine with a big, I love physicians, colleagues, but I felt like that was the rate limiting step. The moms, well, usually moms, but the parents that come to me 99 times out of 100, they come and they say, my child has PANDAS. And I say, you're correct. And they've done research and diagnosed their child. It's clinical diagnosis, obviously, as we both repeat
Over and over again.
over and over. And they come to us, and I feel like, the physician community. And so I've said that I felt like it was, love letter to medicine, to
Hmm.
saying, listen, we need to, first of all, listen to patients. Second of all, we need to know that we don't know everything. And who we need to understand the hardest thing probably as a physician is realizing the terrifying thought that some psychiatric illness actually has a biochemical infectious autoimmune origin. And that's a little terrifying because for years we've been kind of told, you have a physical cause of illness or it's psychiatric, and that's an other. It's a beyond. And so we just kind of treat symptoms. And I always tell people, I'm not anti-medicine. There's lots of times these children are benefited by medications, but at the same time, I think we owe patients a little bit more. So my goal was not to attack people that don't believe what I believe or haven't taken care of these kids. My goal was to say, let's start the conversation and here's some info.
Yeah.
And so that's what I ended up. And I have a lot of parents that buy the book as well. And I just think it's, you and I have talked about this. It's just, it's in wanting to have the ability to have a conversation, an open dialogue in medicine where sometimes when people hear new ideas, especially if they involve anything natural or diet or relaxation techniques or any
Right.
infrared sauna, they kind of roll their eyes and they say, oh, here we go with the essential oils again. And I'm like, well, there are times when things are helpful and we don't know everything. So, you
Yeah.
know.
Well, it's a great resource. And one of the things I saw in your book that I loved was, we both know Susuito coined the phrase pandas in the 1990s, but the epidemic after the flu of 1918, the sleep disturbances and other symptoms that some kids got, you were showing that this is not something new. This has been around for forever.
It has, and that was reported in 1926. There was a physician named Johnny
26.
Kahnemoe. So it was the 1918 flu, and then afterward in 26 he published an article, and he called it encephalitis lethargica,
Yeah,
and it was in adults and children. But the description of what happened in children is fascinating. Of course, it's early 20th century language, but he talks about these children are deviants and they run the streets and they steal and defy and they are, robbers, and just describing that sort of behavior that was seen. And unfortunately, at the time, this was described. Some of these children were placed in institutions or imprisoned. And unfortunately, there was a population that were lobotomized at the time,
yeah,
because it was just totally misunderstood. And what's fascinating is years and years later, I think probably in the 80s or 90s, they took sections of people's brains that had the flu and had encephalitis lethargic using modern methods, and they looked at them and did not find virus. Meaning, the issue in the brain that was causing encephalitis wasn't encephalitis from an infection, that it had an autoimmune component to it. And in fact, the changes that they saw in these people were in the basal ganglia. Oh,
right. Yeah, there
right.
you go.
And you think about that and think, wow, that's really spooky, because obviously, and I know a lot of times when I've heard you talk about basal ganglion encephalitis, of course, we know that's what it is with PANS and PANDAS. And I think that when you hear that and then you see the modern studies that, demonstrated MRI or PET scan or whatever changes in the basal ganglia, you say, boy, that's really spooky, and how much of this has gone on over the years. We
Right.
just missed it.
Right. But as you said, it's a new way of looking at mental health
Mhm.
or neuropsychiatric diseases. Certainly a genetic predisposition, because it's
Right.
not 200 kids that get strep that walk in with pandas. It's 1 in 200. Even though you and I, it's 1 in 1 with all the testing
Right.
and everything else. But
Right.
and then it's not an infectious disease. It's the environmental triggers, the infectious triggers, the metabolic triggers, the toxic world we live in that incite this autoimmune reaction and inflammation in this area of the brain. And that's a concept that I think is missing in so many of our colleagues' way of thinking about mental health.
Yeah, I think toxins are an interesting concept because, I was primarily, my initial medical training and residency was in emergency medicine. And we were sort of in the ER, you are sort of the initial person seeing people with toxic ingestions, whether it's alcohol or, cocaine, marijuana, whatever it is that you're seeing. But then we're also seeing someone who's trying to commit suicide and taking Tylenol. So you have to understand area under the curve and the nomogram, and when you give N-acetylcysteine and all those things to prevent liver damage. And, back, I mean, when I trained, to tell you how far back was, we were seeing theophylline overdoses. So
Yeah.
no one was that
Oh,
out.
I know.
And so we were seeing that, and we were seeing all of, which is particularly horrible, theophylline overdose. But we were seeing all those things, and we had all this training in toxicology, yet at no other time do we talk about that in medicine. So,
Right.
there was never a discussion about dioxin or forever chemicals, PFAS, or any of those things. We didn't talk about it. And so I think when there's a vacuum and people start figuring out information, it starts coming out, and then the people that talk about it seem like they're not, like they're crazy. So, and I always think back to the physicians who talked about, washing, Semmelweis, who said we should probably wash our hands to reduce
Yeah.
maternal mortality. And people are like, you're crazy. And they took his medical license away. And the same thing happened to the person who suggested that H. pylori bacteria could be connected to ulcers, and the person who suggested we could put a little tiny catheter in your coronary artery and blow a balloon up and open it. And people were like, that's impossible.
Yeah.
And of course, all those things are standard of care. So.
Yeah, and maybe we've made some inroads in that the AAP has finally come out and recognized PANS and PANDAS. I think we all agree that it hasn't gone far enough, hasn't looked at or commented on the most recent research that really shows us that this is a real phenomenon, disease. But maybe we all won't be as crazy as we are in a few more years. I don't know, but.
And I think, if I keep saying I'm gonna get around to writing a letter, but I think the people that they need to talk to are you, Dr. Sweeto. They need to talk to people from their own, right? They need to talk to
Yeah,
pediatricians who, and when I was writing my book, I kind of said, I want to write this from a physician to physicians. And I remember telling my editor, there's going to be languaging, and before you change anything, you need to ask me because there's things that physicians say to each other and that I'm going to leave in there because that's how we talk to each other. Like
yeah,
80 years old and have chest pain, it's a heart attack until proven otherwise. People are like, that's clunky. That's a weird way to say it. Like, well, how we talk. And so that type of thing. And so I think having pediatricians, you, Dr. Sweeto, Lisa Song, people who are kind of members of that academic group coming in and saying, hey, listen, we train, we're board certified, and this is what we see. I think that's really powerful. And I remember when I was writing my book, I was thinking, it would be hard for physicians to hear some of the things in my book from a non-physician, just because I feel like we're going to change, right? I feel like we're going to change people. So that idea of inroads is fascinating to me because I feel like that's how you get to the people trapped on the mountain, is you make an inroad and get there.
yeah, yeah. And we're working on it. Certainly Aspire.care is at the forefront of trying to write a very comprehensive, compassionate, but detailed response. So you're absolutely right. It needs to come from all of us on the front line. So
Mhm.
anyway. I've also been fascinated when we lecture together about some of the things you're doing with hypnosis and neuro-linguistic programming and the brain danger response. And as somebody who has worked with Bob Navio and worked with the cell danger response, I'm fascinated by the brain danger response. Can you talk about what it is and how it relates to the symptoms of PANS and PANDAS?
Sure. So how I explain it most often to patients, so we know Dr. Navio did I think the initial publication was 2014. He published another article in 2020, kind of elucidating a little bit more the role of the environment in producing this chronically activated cell danger response. So in brief, sort of when you have a challenge to your body, and whether it is an infection, a toxin, a physical trauma, or a psychological trauma, your body mounts an immune response to protect you. That's what's supposed to happen. And that response occurs initially wherever the thing starts. So let's say you have strep throat. In your throat, cytokines, these chemicals that are inflammatory cytokines that wake the rest of your immune system up, get released. And this thing happens in your mitochondria, the little energy storehouses in your cells. They kind of wake up and they release some of these chemicals and alert other parts of your immune system, both locally and then downstream. And that cytokine release, that's called the cell danger response. So then what happens is those chemicals from wherever that is in your body go up your vagus nerve into your brain. And then in your brain, further cytokines are released. And you get some of the things that we attribute to illnesses, but are actually our own doing. So, for example, a fever. So, pyrogens in your brain are released, which cause your thalamus to increase your set point, and you get a fever. So, I always tell people strep throat doesn't give anyone a fever, you give yourself a fever. And so, the flu doesn't make you vomit, you make yourself vomit because the flu, your brain, it activates the immunogenic center. So, that response is supposed to turn on, you beat the invader, you deal with the problem, and then go away. Once safety in the body is restored, that goes away. And so I started thinking, what are we seeing in these kids? Why is it even as many as 1 in 200? Why is this happening to people when it's not happening to all 200? And so, yes, you can say, sure, there's genetic predisposition, as you and I have seen siblings in families. But at the same time, the answer seems to be a dysregulated immune response. So we always talk about the autoimmune attack on the brain. So I think of that as an exaggerated response. But there's also, as we've talked, this immune deficiency. They don't
Yep.
produce antibodies to pneumococcal vaccine, or they don't. I tell parents the easiest to understand is you have a child with PANDAS who they get sick, but they don't get sick. Their behavior just changes. Then the mom takes them to the office and you swab them, and they have strep, even though they have no fever, no sore throat, no rash, no vomit, nothing.
Right.
And so that's an indication those cytokines, that process is kind of dysregulated or broken. And so Dr. Navio goes on to describe that there's this chronic turned on cell danger response, and he then likens it in his article from 2020 to environmental toxins. In other words, you're always being challenged with stuff. And of course, we're in a stressful society, and there's social media and pressures and things on kids and adults. And so we have this chronically turned on cell danger response, and then couple it in these kids with this immune dysregulation. The immune system's not quite sure how much or how little to operate. And what you really get is, and so I started kind of researching because I was already using neuro-linguistic programming and hypnosis in some of these children to help with some of these things. And I started thinking, why do they get OCD? Why do they get anxiety? Like why do they get that? And what it ended up as, kind of in my own mind, I worked it out as, you have a situation where you have an infection or a toxin or a challenge, and your immune system's kind of telling your brain, we don't know what to do. We don't know what to
Yeah.
do. It's an emergency. I'm sick and I don't know what to do, especially if it's an odd challenge to the immune system, mold, or for goodness sake, Bartonella, or something that is just not as common. And so then what's happening is the subconscious brain gets these signals. There's something wrong and we can't figure it out. And I tell people it's very similar to if you're like suddenly in an earthquake. You'd be like, I've been in an earthquake before. I don't know what to do. And so fight or flight gets triggered. And then as you and I have talked, of course, OCD is really a safety response of what can
Mm.
I control in my environment? I guess maybe how clean my hands are or whatever. But I started thinking, this really sounds like it's this immune dysregulation, this chronic cell danger response, like that's what's going on. And so I said, what's really happening is it's a brain danger response because the cell danger response is turned on, the immune dysregulation is there, now we have infection, now we have antibodies in the brain. It's this sort of brain danger response. And so then I was preparing for the last lecture that we did together, came upon a paragraph out of Dr. Navio's article where he kind of offhandedly kind of says, in some cases, this um, cell danger response is dysregulated, gets stuck on, and in essence, it bubbles up as a cellular form of anxiety. And I
Hmm.
thought, oh my gosh, that's exactly the thing. It's
That's it.
cellular form. And then he says that cellular form of anxiety can then, I'm paraphrasing, but can then develop into anxiety, addictions, OCD. So
Yeah.
he develops that sort of process, and I'm like, there it is. That's what we're seeing. We're seeing this brain danger response. And I said, that's kind of, I think, what we're seeing here. So I'll tell parents a lot now, you know, the OCD is not a thing itself, it's a symptom. The anxiety is not a thing itself, it's a symptom. If you
Right.
want to call something depression, that's probably a dorsal vagus nerve response, but they're all symptoms. And so your child is not having an abnormal response. They're screaming fit and breaking things in the house. It's not abnormal, it's just at the wrong time. So I
Right.
tell parents, your child's not a broken toy. They're having a fight or flight response. We want them to have that response if they're walking home from school and a white van pulls up and tries to pull them in the van. We want them to kick and scream and scratch and yell profanity. And we want
Yeah.
that stuff. So it's this thing that's occurring at the wrong time. So once I started going down that road, I thought, the primary situation is I'm not safe. And if we can get them back to I'm safe with the subconscious brain, then we should see an improvement in symptoms. And then during the pandemic, of course, some people learned to knit, some people learned to do other things. I one day stumbled across, as I'm looking at videos late at night, I stumbled across a video on neuro-linguistic programming. And it's basically the science of language and how we talk to ourselves, how we talk to others, how we encode our own experience with the world, and how we make sense of it. And there's a series of exercises you can do with people with NLP. It's particularly useful for PTSD. And so I see a lot of the parents for that.
Yeah.
Also for phobias, there's sort of a party trick in NLP. It's the fast phobia cure. You can usually take people's phobias away in about 10 minutes. And so I've kind of done that here and there. But then part of a lot of people that do NLP get into hypnosis. And so I thought, well, how hokey is that? That's weird. So I started studying and learning about it and then understanding the process of it. And it just sort of came alive. And then I started, doing it with patients here and there and then had some amazing results. So.
Wow. And when you're talking, I'm reminded of when I listened to Bob once talking about this cell danger response as an army, and the cytokines and mitokines that you're talking about are the sentries that are put out from the army. And, in a healthy system, the trigger, so to speak, goes away and the sentries retreat and we go back to our homeostasis. But this fight or flight exaggerated response, our kids are like they're always at war. That's what they're feeling. So like you're saying, this isn't, your kid's not having an abnormal response. This is a normal response to their brain being at war. And
Right.
that's what you're going through. So I'm so fascinated by how the subconscious mind relates to this and what it does and how you use this in your practice.
So I always start kind of with people by telling them your subconscious mind only has two jobs. It's to protect you and to bring you pleasure. And in
Mm,
an ideal world, you'd want both of those kind of operating and watching out. And so you would have times where you would, make sure you're seatbelted when you're in the car or things like that where you kind of protect yourself or watch your wallet if you're walking in certain places. But then you'd also have other times where you sought, conversation or relaxation or get a massage or things. So you'd have both of those. But what happens is if you feel persistently unsafe, your body does protect, 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 protect. The pleasure goes out the window. So that's actually where a lot of these kids, parents will say, my child's depressed. They don't want to go to baseball anymore. They don't want to, they're an artist. My daughter was an artist. She just stopped. They stopped
wow.
drawing. They don't want to play with the dogs and cats and things like that. And you look at that and you think, wow, that's really too bad. And so, from a conventional standpoint, we look at that and we say, well, that's depression. And then depression, for depression, we use an antidepressant. And medicines help a lot of people for sure. But as you and I know, that it's less so in pandas, and a lot of children will become activated on those medications. So it can be tricky. Uh,
Yep.
but when you look at it from that sort of take a step back and you think, wow, maybe the solutions here are making the situation safe. And when things are safe, then I'll want to draw or want to go to, Girl Scouts or do the thing. And so that's really, really what we've seen. And so I'll start the conversation with a few things, with talking about the subconscious and then talking about these reactions, as I said, as normal, reactions, just mistimed reactions. And I'll talk about, the fact that a lot of it is with OCD is everything gets exaggerated. Everything is connected to death. People kind of think, well, he wants to wash his hands to keep his hands clean and not, get dirty or get sick or something. And in reality, the overblown reaction we see is kind of like, if I don't wash my hands, I'll die. And the children can't a lot of times verbalize that, but it's with that intensity. And I tell people, you can't reason with these folks when people are stuck in a subconscious state like that. It's kind of where conspiracy theories are born. Like, I'm not safe, it's not safe, the government's not safe. And and it's really hard to reason with people or to have them hear things that, well, you're part of the conspiracy. That's why you're saying that kind of thing.
Right.
And so that's where these kids end up. And I tell parents, you're not going to win the war by saying your hands are clean. Your hands are clean. Let me look at them. Yes, your hands are clean. Or answering the repetitive question for the millionth time. What you have to actually do is instill safety. And I'll tell children, sometimes they'll come in and I'll say, hey, buddy, why are you here? And they'll say, you want me to stop washing my hands? And I'll say, I could care less whether you wash your hands. Wash them 1,000 times a day. It doesn't matter to me. There's no morality in it. You're not a better person if you wash them 5 times a day or 100 times a day. But I'll say to them, my job is this. My job is to prove to you that it's safe to wash your hands 1,000 times a day. And it's also safe to wash your hands 3 times a day, 5 times a day, whatever most folks do. Both are equally safe. And then you get to make a choice. Now, most people, given that situation, they're not going to do it 1,000 times. That's boring and takes time, and your parents have to pay for soap, and your hands are cracked. Everything you touch is wet all the time. Like that's the lifestyle, right? And so I'll tell them, I'm here to give you that choice and decide what you want to do. And if you decide in the end of this and you're able to do both, and you decide on 1,000, do 1,000. Live, do you do you? It doesn't matter to me. But that idea of installing safety in that realm is I think a lot of what I do. So a lot of neuro-linguistic programming is kind of reframing things for people like, OCD is a normal response. And a lot of the folks that have OCD, I'm one of them. I had OCD when I was about 16, but a
Me
lot
too.
of that is, I think, and I talk to parents a lot about this too. I think that everyone who develops OCD had a hyper vigilant or hyper aware personality type to start. And then when they get sick, they get pushed into OCD. So I always say that the people that are, that develop that OCD, they have that hyper aware personality type. And that's why you get a kid that's like, don't touch me. Your hand touched your purse, and your purse touched your coat, and your coat touched your shoe, and the shoe touched the ground, and a dog pooped on the ground across the street. They make this big chain of things. But that also, those same people are empathetic. They tend to be empaths. And so they are the person that will, when someone walks in the room with a little teeny tiny tear in their eye, they'll say, "What's the matter? I think there's something wrong." And so this hyper aware, so that hyper aware personality type is really beneficial if you're in like a job where you can't make a mistake. So healthcare, being an
There's a lot of
airline,
us.
being an airline pilot, things like that. And so when that happens, but when you get pushed, you get into OCD. So I'll tell parents, they'll always have that hyper personality type. So they may always want things kind of just so. We just don't want them to be debilitated by it, where they can't go to school or feel like they can't go to school. I also work a lot on languaging with parents. So I'll say, don't tell me your child can't go upstairs. They don't want to go upstairs. They're uncomfortable going upstairs, but don't say, I can't go upstairs. That's a little bit of self-hypnosis. In the same way, if people say, I'm just a lazy person, or I'm always late, you hear people say that. Well, that's not a thing, an always late person. You may be doing that, and a better way to say that might be, I don't prioritize preparing and being early. And so because of that, there's a consequence, which is I'm late. Doesn't mean you're a bad person, you're just late. And so, there may be consequences. So I tell people a lot, I'll talk about consequences. Like there's no good or bad food. Food just has consequences. So
Yeah, and I think the way you're describing it also is very important because so much of the time parents are trying to normalize, your hands are clean or you don't need to do that 20 times or on the other end answering the question 20 times and then getting so frustrated and blowing up. But giving them the choice and saying, "Hey, yeah, you can wash your hands 1,000 times or wash your hands 5 times." It's getting to that level of normalization that I think is so fascinating and so helpful for all of these kids. And how do the parents respond to it when do they hear you? Can they take that message and take it home? Or
I
are you
think
finding that difficult?
I think the kids smile and the parents usually cry because one of the things, I did with my daughter that a lot of parents do is they get sick and you think, oh, I thought their life would be so much different. We kind of project, right? And so I thought, oh gosh, because of the way she's acting and feeling, like she'll probably never get married. She'll probably never have kids. I don't know that she'll end up in college. Like she can't read a sentence. And so I think saying to parents, I'll also talk to them a lot about, don't reinforce this idea that your child's sick. Like, don't tell them you're sick.
Yeah.
You're sick. And don't join them in suffering. It's something I had to get over doing with parents. It's another part of neuro-linguistic programming and a little bit of hypnosis, which is I'll say to someone if they tell me this tragic story and they're tragic, I'll say, boy, that sounds really hard. And try and avoid saying, oh my gosh, that's terrible. You must be so unhappy and scared and terrified. And kind of join them in the suffering. It reinforces kind of that suffering. How I look at languaging is more of a coaching. And so I'll tell kids a lot of time, look, I'm here to give you freedom so that you can do what you want to do whenever you want to do it. And then the second thing I'm going to tell you is you just got some stuff in the way. You're a healthy person underneath this all, but you've got some stuff in the way, probably some infections. We're going to get them out of the way. Some toxins, we'll get those out of the way. We probably got to make sure your immune system's not acting weird. And then at the same time, we have to give you some tools that you can use when things happen like this, where you get in a little bit of trouble. I also do a lot of hypnotic languaging with parents. You talked about repetitive questioning, and that's true. Your choices, the most common choices people make when a child is repetitively questioning them, am I sick? Am I sick? Am I going to vomit? Am I sick? Is this shirt clean? Is this shirt clean? Parents will either answer them every time, at
Right.
which point you strengthen the obsession, the ritual. Because the problem with that is, I know when I had OCD and my daughter will say, that the thinking you're thinking isn't right. Like, that it's illogical. That the things you're doing don't make sense. And there's a lot of shame with that.
Right.
And so what I'll tell parents to do in that question, so a lot of times parents will give in every time, but if you are thinking what you're doing is illogical and suddenly your parent joins you in that and accommodates you, you think, oh, good boy, I thought I was crazy, but now my parents doing it and I know they're fine. So now I can relax because they're going to help me do my ritual. And now I feel safe again. So it kind of reinforces and strengthens. But what I'll tell parents is if your child's asking a repetitive question, most parents will either answer it every time or get frustrated like I did and say, stop asking me that question. You're driving me insane. Like, I answered the question already. Or parents at some point will get to the point where they just give them the silent treatment. They just don't say anything at all. And the problem with any of those is you're either strengthening OCD or you're leaving the kid hanging where they're stuck in this anxious state and can't resolve the thing. So I'll tell parents the better thing is to break that loop and get them out into left field. So I'll tell parents what you can say. If the child says, am I sick? You can say to them, I really admire about you is that you really care about your health. And a lot of kids your age don't care about their health. And so I really admire about that you. That's really mature of you. So what you've done is you haven't answered the question, you haven't refused to answer the question, you've taken them somewhere else. There's a compliment in there, and you've kind of broken that loop. The other things I'll have parents do is a hypnotic pattern interrupt, where I'll say, clap your hands really loud and get up and say, oh, I think I left the clothes in the laundry. And then get up and go to the other room and do something and come back. And a lot of times that will be enough to disjoint the ritual enough to get the person over it. And sometimes the children get wise and start saying, why are you doing that? Or why you keep saying that? And whatever. And so after a while, but a lot of times that's enough to kind of disrupt that
Yeah.
loop with it.
Yeah, that last piece you said reminds me of Tony Robbins videos I watched like 30 years ago, where he would talk about touching your shoulder and changing. But also two things. One, I call it don't feed the beast of the disease. When you're answering and answering and answering, you're getting into that loop. But what you're really talking about is what we talk to parents about in distracting their 2-year-old. It's a manner of distraction by not answering them, but helping them in a way to know they're being heard. Because I do think the silent treatment really gets kids much more in their head. I often talk to parents about saying exactly what you're saying, but saying first, I get it at some point in time. So they feel heard. But
Right.
this change in distracting them and saying, I really like the way you're thinking about your health, or you think about that more than that's a fascinating point. And I think one that a lot of parents could take and use very quickly that could change the direction of their kids' OCD. Do you
Yeah,
go ahead?
it, it's a so it's very similar to when you get your pocket picked, right? And people bump into you. That little bump jars you, and your brain, there's a split second where your brain's trying to figure out, was I just hit by a comet, or did a
Yep.
dog bite me? What thing just happened to me? And in that moment, people take advantage of grabbing your wallet because your senses are all jumbled and you're not paying attention to things. So that concept of hypnotic pattern interrupt is um, it's really a powerful way, because if you can get to the person, and I'll do that a lot in the office too, because you can really get in there. What's fascinating about Tony Robbins too is that his original videos from the early 90s, he talks constantly about NLP. So he was trained initially in NLP and then developed the $1 million mindset and all the other things he does out of that. So a lot of his techniques, getting affirmation from people. Do you hear me? Do you hear me? If you hear me, say I, that kind of thing. That's all neuro-linguistic programming and hypnosis. But the other thing I was going to say earlier was, the other thing I'll tell parents, and I say it in front of the kids, um, is that people will always talk about the socially acceptable OCD. They'll talk about washing their
Mhm.
hands or whatever else. But OCD, when you delve into it, there's sexual thoughts, there's thoughts of suicide, there's thoughts of, murder and all of those things. And these kids can really feel like there's really something wrong with me. Like I'm really, and we get thoughts of heaven and hell and all those things. And I'll tell parents, if your child doesn't want to talk about subject matter, if they say, I have to wash my hands, and you say, why? And they say, I can't tell you, or I don't know, it's fine because the thought, that's all from your subconscious. It's what you dream from. Does it matter? Why? If we can change the behavior and make them comfortable with it, that's the goal. So when I say that a lot of times to kids, they kind of look up at me because no one's told them that before, that the things they're thinking are just protective. It's
Yeah.
not, that it's not, I never use the word crazy, but it's not because their mind's broken. I'll say to them a lot of times. Yeah.
Yeah. That's a great phrase. And I've had many kids, I can't tell you or I'll die. And parents, or you got to tell me, why are you going to die? And you're absolutely right. We're just feeding that intrusion on them. Now, how quickly, when you start using the neuro-linguistic programming, or when you start using the hypnosis with the family, I mean, in some kids, I think it can happen like that. Do you find that happens, or is this something that takes quite a long period of time, depending on how much is ingrained, I'm sure, et
I
cetera?
think it's in every encounter. And so sometimes it's hard to trace. There are clearly cases where I've done a single session of hypnosis and things have dramatically changed on the spot. I also tend to do a needle phobia trick with children of self-hypnosis with kids before they get blood drawn in our office if they're really skittish. That's worked really well for them. So there are things that work quickly. I think a lot of it's molding over time. One of the things in NLP that's central to NLP is making rapport, getting rapport with people and figuring that part of things out. And so one of the things from the very first call that I'll do with parents is something called pacing and leading, where, if you get, as I do, I'm sure you get the parents that are talking to you and they're all kind of animated and you don't understand how bad it is and it's terrible. And they're crying and everything else. And so one of the things you can do is called pacing and leading, kind of meet them where they're at. And then you slowly, when you're in kind of coherence with them, you kind of slowly change things and ratchet down and they'll come with you.
Hmm.
So they already look at you sort of as a physician, as a sort of authority, or you're in charge or something. I always tell them they're in charge. I'm just the navigator. You're the captain. Um, but if you have someone that's sort of hyper animated like that, then I'll become hyper animated and I'll say, I know it's just terrible. It's exactly the same with my daughter. And then once we started getting her better, it really seemed like everything just calmed down and was completely, better at that point. And so you'll feel the person come down with you at that point.
I
So
could feel it right there. I
yeah,
mean,
so
just in those seconds, I know.
well, my
And
kids
and
tease me because I get into my hypnosis voice sometimes.
yes, my son calls it my autism voice. Uh,
Yeah.
Yeah, it's the same thing. And it's funny you said when you call them their navigator, I almost at every new visit, I'm talking about me as their GPS,
Oh, there you
and
go.
it's the same thing, and I may be a pushy GPS, but you're still driving the car and I'm
Right,
here
exactly.
to give you a route to go down. But you have to choose if that route is good for you and your child. And that can be the financial route, or my kid won't do this, or I can't do this, or I don't agree with you or believe in you. But we're not, as doctors, the be all end all and have all the answers. If we can put ourselves there, and you and I certainly can because we've been through it, but if we can just listen and help navigate them to a place, and the voice technique that you use just for a few seconds, that just shows it right there. Like
Mhm.
you brought them down from that slightly more manic level. You didn't get to the total mania you and I hear many
Right,
times, but
right.
to a calmer pace. That really is so powerful. Now, how did you, I know during COVID you did this. This was your knitting of the time, but how did you learn about it? Where could practitioners, physicians, or even parents that want
Mhm.
to do this, where can they go to learn about this?
So the original founders of Neuro-Linguistic Programming were Richard Bandler, and I can't think of the other guy's name, but Richard Bandler was, I guess, he's sort of the most well-known. He's written the most books about it. There are many books about NLP, but anything by Richard Bandler is good. I did a few online programs. I did something called NLP Comprehensive, which is a course, kind of physician-heavy course for that. And then through that, got several leads, and I did several. This course was during pandemic, nothing was open, so I did multiple online hypnosis courses and certifications. But my real love for hypnosis came from Milton Erickson, because one of the
Yeah.
hardest is getting these kids relaxed. And so it's almost impossible to do a traditional relaxation trance with kids that are, especially when they're scared or hyped up. And so you kind of can't say, well, close your eyes and you're feeling your legs get heavy, whatever. It's just really, really hard. And so Milton Erickson was sort of the master of waking hypnosis, where he would kind of look at someone and just start talking, and using his voice and his meter and the way he spoke, he would kind of get them fixated or entranced, and then he would just start giving them suggestions. And when you give suggestions in hypnosis, it's basically reminding people of their capabilities, and a capability that they previously had or that they had at another time. Because most of these kids were at one time well or normal acting, and then had some type of change. Even if it wasn't exactly a sudden onset, they had a change at some point. And so taking them back and kind of reminding them of those things. And I'll often use illustrations with kids about riding a bike, about, look at
Mm,
that really dangerous thing that you did of riding a bike. Like, people get really hurt, and you learned it when you were very young and became stable. And remember when you started, it was so difficult. And now you're able to balance and turn and wear a helmet. You could probably even hold a drink while you're riding. Don't do that. But that type of thing, where anticipatory guidance, right? The pediatrician gets so, but that sort of thing where you're reminding people of capabilities that they've had, and reminding them that they're an expert. If someone has trouble sleeping, like, if it takes 10,000 hours to be an expert at anything, playing the violin or whatever, how many hours have you slept in your life? Like, normal. You may be having trouble sleeping now, but in essence, you're a sleep expert many times over. So if we can get you back and remind you of that, and
mm.
about all those things that you do, or like, gosh, if you drive a car, amazing how many things you're doing at the same time. So those types of things can be really helpful. Yeah.
And Scott, remind people where they can find you
Mhm. Yes. So
if you'd like.
yeah, so our office is in Carmel, Indiana. It's called the Center for Fully Functional Health, and it's fullyfunctional.com is our website. We also are on both Facebook and Instagram as the Pandas Docs. And I have a separate website, which is thepandasdocs.com, where my book is for sale, cheaper than Amazon. And also I have an online course there, which I'm in the process of revamping, because I'm adding a lot more about hypnosis and neuro-linguistic programming. I spend a lot of time talking to people about that in my office. So
That's great. I'll have to go to that one. I'll have to take that course. But anything you'd like to leave people with, any words of wisdom, since there are so many of them in your head. Are there any you want to give to everybody now?
I think if the few things that seem to be most impactful with parents, and I always tell them, I'm going to tell people the truth. I don't tell people things to just make them feel better, but I try and remind them that when I'm telling you things, and some of the truth you might not want to hear, like, you don't need to, you need to not accommodate your child with OCD, something like that. But the big things I tell them at our first visit is, first, it's not your fault.
Yeah.
Because many of the parents will sit, and the moms particularly will feel very guilty and think, oh, I missed a prenatal vitamin when I was 4 months pregnant. That's what did this. And I just tell them it's not the case. I tell them there's hope. And so I'm a big fan of online support, but a lot of times online support groups kind of lead people to believe this is, your child's just this way, and they're just not going to get better. And your life is, every time they get the sniffles, they're going to, break a window. And so I kind of like, that's not what you and I see in our practice. And is not true. So,
Right.
so there's always hope. And so it's not your fault. There's always hope. And the reactions your child are having are normal. they're just at the wrong time. I think those are kind of the big things that I leave parents and kids with, and that seems to be the most impactful.
Well, I really appreciate that. And I know there is a lot of hope coming out of your practice and a lot of wisdom. This book is incredible. Your work is incredible. I'm excited to lecture with you at MAPS in March in Myrtle Beach and hear more, and just so grateful that our paths have crossed.
Yes.
And that I found my brother from another mother.
Sure.
And glad also that our kids are doing well and that there is hope for all of our families. So thank you, Scott. Really appreciate it.
Oh, thank you. My pleasure.
That's it for today's episode of Demystifying PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANDAS.